Good evening, Los Angeles, and thank you for joining me this evening. 6,124. Many of you may know that number already from the county's briefing today. Maybe you've seen it leading the news. And it mirrors numbers we're seeing across this state, across our country, and across the world, as records are being shattered by the number of people whose lives are being shattered by COVID-19. Here in Los Angeles, those 6,124 cases that the county announced today, some 2,694 of them in my city, the city of Los Angeles, are showing us that this pandemic, at this moment, is threatening to spiral out of control. We are at the highest risk level that we have been. We're seeing numbers that literally 3 weeks ago were half as much. In fact, in our hospitals now, we have 1,575 people who have been admitted into hospital, many of them into intensive care because of COVID-19. And most numbers, in fact, all of these numbers, have names. The names of beloved people who are members of our family, our coworkers who were right next to us yesterday, our sons and daughters, mothers and fathers, grandparents, who now we're praying will recover. Just 3 weeks ago, in our hospitals, that number was half. And in the last week alone, we've seen it accelerate even more, with hospitalizations going up 50% in the last week. At this rate, our hospitals won't have any spare beds by Christmas time. This is not news that I'm happy to share. But one thing over these last 256 days of this horrible pandemic is that we've had trust, and I've always shared the numbers I receive with you as soon as I get them, so that you can know the power that you have and the wonderful work you have done to protect and to love your neighbors, your family members, and to take actions that save lives. As your mayor, my first responsibility, whether you agree with all my decisions or not, will always be to protect you and the lives of you and your loved ones in this city. And I know our county supervisors have that same thing, our city council members as well. Each one of us know that we are called to serve, and in serving, the first thing we need to do is to make sure that lives are saved. The decisions that we make, I know, are not always popular, whether it's a governor or a supervisor. They are the heaviest ones of our lives, but sometimes they have been the easiest decisions to make. Knowing that years from now, I will pass by someone who's still alive. I won't know they're alive because of what we collectively did, but they will be. And here's one more number that I want you to know. 11,511 Angelenos. Imagine for a moment we were told that more than 11,000 of us were going to die in this city by the end of the year. And now imagine if somebody said we could do something to make sure that those lives were saved. County projections say between now and the end of the year, if we continue at this pace, 11,511 Angelenos in this county will die from COVID-19. Isn't that something worth fighting against? Aren't those lives worth saving? You and I both know that answer. And I'm not going to talk down to you tonight. You know all too well, and you've shown all too powerfully that we know how to beat this virus. There's so much we can be proud of collectively looking back. Today, I joined with a group of mayors to brief President-elect Joe Biden and Vice President-elect Kamala Harris on the state of things in our country through our local leaders. I was given the task of asking them a question and sharing with them the news from our city around COVID-19, and to ask them the plans around COVID-19. And as a side note, I want to thank the GSA Administrator, Emily Murphy, for finally moving forward with a transition of our government, because both of them shared that they aren't even part of Operation Warp Speed. They don't have the information they need to prepare to save lives when they take over as our president and vice president. But before them, I shared LA's amazing story, the first city in this country to shut down our bowling alleys and our movie theaters and restaurants and places where people met. The first big city in America to mandate masks when people didn't know whether that would save lives or not, or were arguing back and forth. The first big city to offer widespread testing for free to everyone with and without symptoms. And the first big city in America to have an equity officer that helped us be one of the first places to bring African American deaths, to save black lives when they were dying at double the rate of the represented population. But the other thing I told Joe Biden and Kamala Harris was, it doesn't matter what you've done last week or last month. COVID doesn't care what we've done before today. COVID only cares how we are acting right now. And the moment we stop acting to protect lives, the moment we ignore the numbers or hope that somehow they will just go away, is the moment lives are lost. Remember the difference between Los Angeles and New York, those precious days where we were a little bit earlier to shut things down and we avoided the tragedy that we saw in our sister city in New York? They were doing everything they could. They acted heroically. Their nurses and doctors and hospital professionals did everything they could, but once you reach past that tipping point, it gets too late. And all you can do is watch this virus burn itself out at the cost of thousands of lives. Los Angeles is on a very dangerous path. And if we don't make changes soon to our day-to-day lives, we'll have more infections, more suffering, more hospitalizations, and yes, more death. So I'm here before you to share what our public health professionals, our political leaders, and our community leaders are saying, so that we can take those simple acts and those strong acts and do them right now with the same depth and determination that we showed this spring and save our city. Public health officials at every level have been making decisions and providing guidance. I know how tough it is for our Board of Supervisors that last week asked for a series of triggers if numbers got too high, of things where we could trim the sales, trim the hours, and yes, if necessary, have people stay at home. I know those are tough decisions, and I want our public health professionals and our supervisors to know I support the decisions that you'll make. I support also our governor's decision and the state mandate right now that between 10 at night and 5 in the morning, that except for essential work or essential trips, that we stay at home. There's too much transmission happening here right now in this county. Too much transmission with too many meetings of too many people. So the solution is simple. We know it, and we can do it. Stay away from each other. Assume everybody you would see is infectious. And please, let us not make this Thanksgiving the deadliest day of this pandemic. I know how painful it is. I know I'll be FaceTiming my mother and father, who I've seen for Thanksgiving virtually every year of my life. But I want to spend Thanksgiving with them next year. We often think of love as often being with someone who we love. We know this year, love is not being with someone that you love. To stay with that household, not to have 2 or 3 in the backyard. Try doing everything you can to help us collectively bring down the rate of transmission. And to our businesses that are affected, I've said from the beginning, we will never stop working to try to mitigate the loss and the suffering of you and your workers. And I'll be saying a little bit more about that in a moment. When we've hesitated in the past, let me be clear, we arrive at these measures later instead of sooner. In other words, the economic suffering goes on for months instead of potentially weeks. And the damage done in lives lost can never be repaired. Whether you own a restaurant or work in one, or you've been supporting the industry by dining out or ordering in more safely, I know there are a lot of worries out there. I've spoken with our city council president, I've spoken with our county supervisors. Know that if those orders do come down, where we have to stop outdoor dining or limit the hours of other businesses, we will take the funds that we have in business assistance and surge them into those industries to get us through this period, to keep those businesses alive, to protect those jobs, and to make sure that they can stand up again. We could keep everything open, and eventually they will close anyway, over a longer period of time because the numbers would be even more devastating. And I think that everybody who's asking questions, those are good and fair questions, ones that I share. And the plain truth is there aren't a lot of satisfying answers out there when people always say, where exactly is this coming from? It's coming from gatherings, it's coming from public places we meet, and it's coming from the weather. This clearly is one of those seasonal viruses like the common cold or the flu that surges at certain times of the year. And we have to accept that that is not just a reflection of things we're not doing, it's just the reflection of the month and the months we're living through, and that we have to accommodate that, adjust to that in order to save lives. The county has made it clear that flattening the curve right now, it's the only way to get to reopening businesses, to restoring our economy. Maybe the good news of the vaccines has inspired us to let down our guards a little bit more, but it's still some months before we can distribute 20 million doses of that vaccine to 10 million residents of LA County. The responsibility of stopping this surge rests in our hands today. First, stay at home as much as possible. Second, don't share your air. And third, change your Thanksgiving plans. If that hasn't been crystal clear enough, and I know it's tough, but it's not that tough. Let's just not see other households. Don't travel cross town because it seems like a short trip and all you've heard is you can't travel nationally or regionally. Don't travel at all. There's nothing abstract about that. I think we all can feel COVID creeping in. I know more people who know more people or whose partners and children are quarantined or have come up positive. I know all of you out there, maybe a few of you are lucky enough not to, but we all see and feel those new cases. We see it in our testing centers where yesterday 29,400 people came to city testing centers, a new record. As a side note, our testing will be closed on Thursday and Friday, but back open on Saturday because of Thanksgiving. And I want to thank all those volunteers from CORE, 500 people who are helping every single day to make sure that we can get that testing done. If you'd like to volunteer with them, step up and help them, please visit their website, which I'll give you in 1 second. And by the way, please donate to CORE as well if you can. It's coreresponse.org, coreresponse.org. And along with our firefighters and so many people from the county, our medical personnel, do get tested and go to coronavirus.lacity.org/testing or call 311. And we have the capacity to continue expanding testing to meet the need. We know that this is rare in America right now, to continue to have a quick turnaround time and to make sure that people can get tested within days whenever they need it. So take advantage of that. But a test is not a passport to party. A test is not an excuse to go to somebody else's house for Thanksgiving. A test is to make sure you know if you're positive so that you can isolate. And remember the rules. I know it's confusing. If you're positive, you need to isolate for at least 10 days from your first symptoms. And if you've been exposed to somebody who's positive, you need to quarantine for 14 days. I know it can seem like a long time, but it's the way that we can stop this. Our transmission rate is now 1.18, meaning everybody infected is now infecting 1.18 people on average. That might seem like a small number, but that is an exponential increase from where we were. And that will result in us continuing to see cases potentially double every couple weeks. Can you imagine if we're past 10,000 cases in just a couple weeks? Can you imagine what it will mean to see our hospital hallways filled the way we saw in New York or Northern Italy? Let's make sure Los Angeles never gets there through the work that we've done together. I also want to announce about travel, and I hope you all know that if for some reason you must travel because of essential work or an emergency, the state of California is recommending a 14-day self-quarantine for anyone landing at our airports. And tonight, I'm announcing an additional step for anybody flying into Los Angeles, so that they are fully informed and educated about our recommended quarantine. So beginning Wednesday, all passengers at the two airports, most busy airports we control, LAX and Van Nuys, or at Union Station will be required to fill out a brief online form acknowledging the state policy that recommends quarantine. And visitors arriving at LAX or Van Nuys will be informed of this new requirement through signs posted throughout the airport, and airlines are being asked to notify their passengers. It'll take less than a minute, but you can see this form at travel.lac.gov travel.lacity.org, and it'll be available starting this evening. But again, if there's any way for you to avoid travel, cancel those plans. Emergencies and essential work travel should be the only excuse why we get on a plane anywhere right now. You see, everything that we're doing right now is focused on a singular goal: to save lives, to make sure that our economy springs back, to be certain that when the holidays roll around, that we're not looking at a Christmas with people dying in our hospitals and no beds available, but maybe a place where, yes, we're with our families and our household, exchanging presents that we bought at local businesses because we responded to this right now, at this critical juncture. In addition to the new rules on outdoor dining that seem like they are coming online Wednesday from the county, I wanted to reiterate other key updates from the county and the state. For businesses that are operating indoors, you are now limited to 25% capacity. At personal care establishments such as salons and tattoo parlors, everyone is required to wear a mask, and services are by appointment only, no food, no drinks. And the state of California, as I said earlier, has implemented a curfew, or at least only essential travel, from 10 to 5 a.m. for all cities in the most restrictive COVID-19 tier, and we are in that tier. And that curfew is in effect until at least December 21st, meant to slow the spread of the virus by restricting parties and late-night activities, events that are accelerating the spread statewide. So in Los Angeles, that means all of us should stay inside our homes between 10 p.m. and 5 a.m. with the exception of essential activities, buying grocery, visiting doctors, if you work in those hours, or other healthcare providers or essential services like pharmacies. And if everyone abides by these rules, if everyone takes these seriously, these small but critical sacrifices, we will get through this. We're not asking you to take up arms and to go overseas to fight a war. We're not looking at some of the sacrifices that have been made by generations before us. We're just asking for you to stay home. We're asking for you not to be with others. It seems like the smallest of asks, but that smallest of asks can defeat this smallest of risks, this virus that we cannot see but that we feel, this virus that has caused so much devastation to us and to our families. We can change the tide. So I shared with you the numbers from today, the 6,124 record cases. LA County is projected to reach 500,000 total cases by year's end. And the 11,511 people whose lives depend on you tonight. You know, the folks that have loved ones in the hospital, I just want to address, and those who were part of the 8 families who lost someone today. And we know those numbers are going to surge. It goes cases and then hospitalizations, which we're seeing surge. And within a week or two, we'll see the deaths surge as well. For anybody hanging on and praying that God will spare their loved ones that are suffering in a hospital, know that we see you and we feel you. And for everybody out there who's lucky enough not to be one of those families, I want you to think about the person you love most in the world, who's sitting next to you, or maybe who you haven't seen, a parent, a loved one, a coworker, and know that they are the one whose life you're saving. Or maybe even as powerfully, it's your own life, that you wouldn't be around for them if we don't do these simple things to be able to save lives and to stop the spread. It's not too late to get the train back on the tracks. I don't believe this is all because of the bad behavior we've done. It's partially just the season. But whatever the cause, a combination of letting our guard down, of not having a season that is conducive to stopping the spread, we know what we must do. This is serious and the choice is ours. And I trust you. I care about you. And I will always do everything I can to protect you and this incredible city filled with angels. If we see more than 4,500 cases a day over a 5-day period, which the county estimates that we're basically at, or if hospitalizations exceed more than 2,000 a day, we'll begin to need implementing further measures. We're maybe right there on that bubble, maybe there, but all the data is trending in the wrong direction. So let's do everything that we can. Let's keep getting tested, and let's keep staying home. Let's keep keeping our distance and don't share your air. And let's cancel those trips and step up and volunteer at coreresponse.org or donate there. Get yourself indoors and get someplace safe. And make sure that this is the moment when we say we met the challenge and we turn the tide. This year has given us a whole new vocabulary to communicate to the people around us who we care about. Wearing a mask, that says, I'll keep you safe. Keeping your distance says, I'm here for you. Acting to protect our most vulnerable neighbors, we demonstrate what it means to be a city that takes care of its own. And much of our ability to take care of ourselves depends on not just the person next to us and the person we work with, but people whose names we'll never know and people who are not part of our households, collectively doing the right thing. If we continue down this road, a lot of people will get sick. But if we take the fork that we have taken twice this year and do everything right, and take this moment to be serious about this pause and this change, we will see things get better. So I'm asking you to keep making those sacrifices and keep feeling strong about your role. And to look back, just as I said, and to see your fellow Angelinos years from now walking these beautiful streets because of what you did. So let's continue to do our part to stay healthy and to stay safe and to stay at home. Strength and love, Los Angeles. Let's rise to this moment. Thank you. As usual, I will take questions and then I'll speak in Spanish as well. I'll take the first question. Thank you.
Thank you. And our first question comes from Joel Pollack from Breitbart News. Please go ahead.
Good evening.
Hi. Good evening. I have, and happy Thanksgiving, by the way. I have two questions.
Sure.
The first is about the coronavirus, which you've been talking about. California is part of a group of states on the West Coast that is going to test a vaccine independently. Do you think that's going to slow the delivery of vaccines to Angelinos? And the second question is about the 300 homicide mark that was reached over the weekend. Yeah. You announced cuts to the police, $150 million in June, and the homicide division has had to cut back, among others. Do you think that is an outcome of the decision to cut funding to the police?
Sure. On the first one, I certainly hope that it not only doesn't slow it, but it accelerates. Testing a vaccine independently and being able, with the incredible medical professionals we have from Washington State all the way down to California, that being able to validate that, reassure people, and to help distribute that will be something that will accelerate states, including ours, be able to have a vaccine and have it more quickly. Second, no, in cities that have not cut the police department, we actually see higher numbers of homicides in many of them. We have made cuts in all of our departments. In the police department, it is a proportionate amount that is shared by other departments as well. In fact, it's a little bit lower as a percentage. And we've seen an average around the country of homicides up during this, even though crime overall is down, during this pandemic, up by more than 30%. Here it's a little bit under that average, but that's no saving grace to know that homicides are only up 26%. We'll have over, as we announced today, over 300 homicides for the first time in more than a decade. And while crime is still at record lows, we're seeing more guns across this country, more ammunition, more shootings, and more frustration. In fact, worldwide, there's trends. When I talk with my fellow mayors around the world, especially where there's easy access to guns, of more violence being perpetrated in the midst of the pandemic. So there's something about this. But you can go straight to cities that have even increased their police budgets, that have had higher increases. So I don't believe at all there's any causality there. Second, we're going to continue making sure that we don't just look at this as an issue of policing. Our police do incredible work. I've never shied away from this podium of lifting up the heroes that are LAPD police officers, and I believe that in my bones. folks who solve crimes, people who go out there. In fact, our Metropolitan Division is working, doing crime solving around homicides in a way that they weren't a year ago, supplementing that. Our officers have taken more guns off the street in the last 2 months than I think any 2 months previous. So there's amazing work happening. But we know that it's not just an issue for police. When I've talked to experts, and we had my cabinet today talk about this issue, one of the things that was crystal clear from our chief of police, as well as folks who are interventionists, is that there's just not enough people with other things to do. The programs we would have, like At the Park After Dark, the gang reduction and youth development programs are not there, and the jobs are not there in a pandemic. So we are going to surge, and are already starting to surge resources there. Dozens of more ambassadors, safety ambassadors. These are sometimes former gang members or people with lived experience who we've shown through studies through UCLA can reduce crime by 40% more than just police officers alone when you bring policing and intervention programs to our streets. These are the peacemakers who know the personalities, the ones who can step in front of the guns and stop the killings. And so we are surging dozens more. They are recently hired, they're being trained up, and they're being deployed. And I do believe that that will help us bring some of this increase down, and it's absolutely critical. Last thing I'll say is one murder is too much, and one death from COVID-19 is too much. We've seen an increase of 40 or 50 deaths probably projected by the end of the year in terms of the homicide rate. When you look at COVID and the 11,511 deaths, I hope we'll keep both of those in our minds and do everything we can. And if folks would like to help on the homicide side, we still are offering youth jobs remotely, especially in communities where we know that's a proven strategy. And so if you're interested in your business hiring a young person to do remote or critical in-person work, please go to hirelayouth.org and be a part of that movement. Thanks so much for both questions. Next question.
And that comes from Dakota Smith from the LA Times. Please go ahead.
Hello, Dakota.
Good evening, Mayor. Happy Thanksgiving.
You too.
There's a lot of talk about your political future, and there's a lot of political consultants who hope there's a mayor's race next year so they can have work. And I know you previously said it's more likely than not that you'll be here in 2022 as mayor. But today, is there anything more definitive that you can say on that topic? Is there anything you can say to the people of Los Angeles about whether you'll be here in 2022 as mayor? Thank you so much.
Thank you, Dakota. No, I don't have anything to add. I will be honest with you. I have been focused 110% on these numbers and on COVID and on saving lives. It's one of the last things on my mind right now. We have deaths that are going to be increasing. We have record numbers of cases, and so I don't have anything to add on that, not because I have anything to hide. I just have nothing to add. My job right now, my job number one, is to make sure I protect the lives of Angelenos, and everything else recedes in comparison. Thank you, Dakota. Next question.
Thank you. And that comes from Ron Lim from the LA Times. Please go ahead.
Hey, Ron, how are you?
Hey, good. Thanks so much, Mr. Mayor, for taking our questions.
Of course.
I have 3 related questions
Sure.
for you. Do you support further measures to implement a targeted safer at home order that will be talked about at tomorrow's County Board of Supervisors meeting? The second is, what do you think of Supervisor Barger's opposition to prohibiting outdoor restaurant dining and another safer at home measure? She argues it's unfair and that case counts aren't coming from reopened businesses, but from large gatherings. But experts tell me it's all of the above. And the last question is, do you have confidence that the Board of Supervisors will make the right decision to protect public health? And if you don't think that they don't make the right decision in the end, what would you do? Thanks so much, Mr. Mayor.
Thank you. Yes, I do support them. I do think that if we don't take this, I know this is not popular with everybody, but if we don't take these sorts of actions now, when will we? Now, we're smarter than we've ever been about COVID. So there are nuances to that. We learned with certain industries, places, to keep business going and to keep people safe. Construction sites, other places where we haven't seen that kind of spread. And if I understand the county data right, it's anywhere from about 10 or 15% may come from outdoor dining. That's not an insignificant number, even if the theory that I've also read from some county data, but I haven't seen it in a kind of granular level, that as much as 50% is coming from people gathering with each other in more private spaces. We have to do everything we can right now. And it's a business argument as much as it is a human life argument. Human lives first and foremost. To protect those, to punch this down over a series of a few weeks, which is my deep hope. And at the same time to surge resources, to keep payrolls and to keep businesses going. I know those are tough things to do and tough things to say, but I'm not here to dance around this issue or to take, half measures and watch people die. I don't think these numbers lie. I don't think that we can sit around and say, let's put this off a couple more weeks. So I do support it. Second, your last question, I do think they will make the right decision. I've talked to a couple of those supervisors today. I know there will be some push and pull. There may be some trimming of the policies. There may be a day or two added here or there. But I think their policies that they adopted are clear. Hit these thresholds and these things happen. I do hope we all collectively, whether it's a city, a county, or the state, always give some time to prepare, because I know how difficult it's been during the year when suddenly 24 hours from now or that moment, suddenly the rules change. So it's good that we've had the notice, and I hope that there will be some notice for, as we've seen in Europe, if it's a stay-at-home order, this is happening on this certain day, not this hour. That helps people be able to adjust. It helps government to be able to take the money that we have. It might not be enough, but we will surge it to those businesses, surge it to those employees, surge it to making sure that things like those restaurants have a shot at surviving. But the business argument is very clear too. Don't do these things, and what are we going to do? Wait till it gets to 10, 15, 20,000 cases, and then suddenly say, we're shutting down, and now we're shut down for 2 or 3 months. I think that that is irresponsible for our businesses, as painful as it is for them to hear this news. So yes, and by the way, if for any reason, those measures weren't taken, of course, and I've talked to fellow mayors like Robert Garcia, who today announced hospitalizations in Long Beach are up 250% in the last 2 weeks. We have the option to be more restrictive inside cities. It gets very confusing. People always come, and some might even protest at my house saying, you've closed things down. I actually don't close things down. It's usually the state or the county. But if there isn't action taken, we do have that option of being more restrictive, but not less. So, but I have confidence in the Board of Supervisors, and I know they are struggling with how to do it, but they will do the right thing as they have all year long. Thanks, Ron.
Thank you. Again, 1-0 if you'd like to ask a question. And now to the line of John Rigardi from the Los Angeles Magazine.
Hey, John. How are you?
Good afternoon, Mayor, and happy Thanksgiving.
You too.
Previously, when there have been threats of a surge and the healthcare system being overwhelmed, you have worked with others to take additional steps. What are you doing this time? Is there any possibility of the convention center being put into place as a field hospital, or anything akin to the early consideration when the naval ship Mercy was directed up to Los Angeles?
Yes, and thank you for the question, John. Whether it's the hospital system and hospitals that we've had closed in the past that we looked at reopening, or whether it's using the convention center as a field hospital, we've kept those contingency plans alive. I had to make a decision about 4 months ago whether we permanently closed that down or kept it kind of on life support, and we've kept it on life support. So that absolutely is an option. We'll consult with the Department of Health Services in the county, which really prepares for the hospital capacity. And look, while it's still some ways off, the way this is accelerating is it doesn't feel like it's that far off. And county projections now do say if this rate of acceleration that we've seen last week and the last 3 weeks continues, I want to reiterate, we could be out of hospital beds by Christmas time. But at that point, we can add more hospital beds. And the hospitals themselves are preparing. They can also adjust beds, adjust more to be for COVID-19 patients. And places like our convention center could be for non-COVID patients or those recovering and no longer infectious. So we absolutely can surge that field hospital up again if necessary, and we'll follow the county's lead. I don't see the Mercy necessarily coming back, though it's something we could certainly ask the federal government for. That what was more useful than the ship itself were the teams that we had. So we might reach out to our military counterparts to have more teams to surge into places that we're seeing hot spots as well. Thanks, John.
Great. Thank you, Mayor.
You bet. Next question, please.
Thank you. And that comes from the line of Elisa Ross from Telemundo. Please go ahead.
Hola, muy buenas tardes.
Hello, Mayor Garcetti, and
Hi.
Happy Thanksgiving to
You
you
too.
and your family.
Thank you.
I was hoping to get an answer in Spanish. Now, tomorrow, your office, along with some partners, is opening a super site in San Fernando.
Yep.
And I understand that super site is going to have a walk-up component as opposed to the drive-through
Yep.
testing site that we've seen so far. What is the need for these super sites, especially with this walk-up component in Hispanic areas for folks that may not have transportation? Can you tell me a little bit about that in Spanish? And also, I understand that at some point you will be able to dispense vaccines from that site. Can you talk to me about that?
That we could dispense, I'm sorry, I missed the last piece, dispense the what? The fee?
I understand that at some point vaccines will also
Oh,
be
vaccines,
given
yes.
at that site.
Absolutely. So all of our sites were okay, I'll say very briefly in English and then I'll give you an answer in Spanish as well. So yes, we do have 9 of the 10 neighborhoods with the biggest surge have been in the Northeast San Fernando Valley. So we are absolutely going to need not only to have more of a site, and some people have said, why haven't we had it there before? We have Hanson Dam. There's coverage, but we need additional coverage. So we're going to make this a mega site, and we did need a place where folks who didn't have transportation could walk up, who couldn't come through a car. We've noticed that in a number of communities. Something I shared also with Joe Biden and Kamala Harris today was that disproportionate impact. 52% of our cases right now are Latino. So we will absolutely be making that available primarily as a walk-up site. Obviously, people can drive close by and walk up to it, but it will allow a dense neighborhood that's transit accessible for people to be able to walk up and to take that. That could be a site where we dispense vaccines. Right now, the county, and we're at the table with them, is looking at a plan that would really be through our primary health providers. But I want to make sure people who don't have health insurance and don't have a place they regularly go are not left behind. So most of us would go to our doctors, go to our hospitals, go to Kaiser or whatever system we're a part of, just as we do with flu vaccines, even our pharmacies, and get that paid for by our insurance. But we're going to supplement that, and that absolutely could be a site. Este sitio en San Fernando es muy importante porque 9 de los 10 vecindarios más grandes con infecciones están en el noreste del Valle de San Fernando. Este es crítico y este es un sitio que servirá a los peatones porque es difícil para mucha gente que no tienen carros, no tienen automóviles, ir a estos sitios. Especialmente en el noreste del Valle de San Fernando, probablemente será un sitio también por las vacunas, porque la mayoría de las vacunas en el futuro estarán con nuestros hospitales, con nuestros doctores, pero hay mucha gente en el condado de Los Ángeles que no tiene acceso a estos hospitales, estos sistemas de salud. Por eso necesitamos tener, no solamente allí, pero en otras partes de este condado, sitios para la distribución de estas vacunas. Hoy yo tuve una reunión con Joe Biden y Kamala Harris y una de las piezas de información que fue un parte de esta reunión fue la incidencia de este virus en la comunidad latina. En el condado de Los Ángeles, la mayoría de los nuevos casos están en nuestra comunidad, en la comunidad latina. Es crítico tener los recursos también, no solamente de la ciudad y el condado, pero en esta próxima administración de Biden y Harris, la asistencia, la ayuda y los recursos por las vacunas y ahora para parar la propagación de este virus. Gracias. All right, I think that was the last question in English or Spanish, so I will now turn to Spanish. Thank you all, and thank you all for taking the actions of saving lives. With that, let me turn to Spanish. Muy buenas tardes, Los Ángeles. Como su alcalde, mi primera responsabilidad es protegerlos a ustedes. Pueden odiarme o quererme, pero quisiera que sepan que mi prioridad es la seguridad de ustedes y sus familias. Este es mi papel, esta es mi pasión y este es mi compromiso. Estas decisiones no deben de ser populares, deben de salvar vidas. La situación se ha vuelto peor en los Estados Unidos y aquí en nuestra ciudad de Los Ángeles. Si no hacemos lo necesario para cambiar esta trayectoria, pronto veremos más sufrimiento y más fallecidos. Y ahora estamos enfrentando la gran posibilidad de una nueva orden para quedarse en casa. Nuestros oficiales de salud pública han estado tomando acciones para evitar lo peor. Ayer en el condado anunció el cierre de servicios de cenar al aire libre en restaurantes sobre las próximas semanas. Nuestras acciones son la única manera de revertir este cierre lo más rápido posible. Estas 3 acciones pueden protegernos a todos. Primero, quédese en casa lo más posible. Solo salga de su casa cuando es absolutamente necesario. Segundo, no comparta su aire. No se reúna con otras personas fuera de su hogar. Y tercero, cambie sus planes para el Día de Acción de Gracias. Con viajar, aumentar la posibilidad de infectarse con el virus. Celebre el Día de Acción de Gracias en casa, con las personas con las que vive. Es la opción más segura. Este año mi familia no se va a reunir, pero ese es lo que todos tenemos que hacer para protegernos el uno al otro. Les ofrecemos ideas sobre cómo celebrar de forma segura en coronavirus.lacity.org/holidays. Si por alguna razón debe viajar, el estado de California recomienda una autocuarentena de 14 días para cualquier persona que llega aquí. Y en Los Ángeles, a partir de esta noche, todos los pasajeros que llegan a los aeropuertos de LAX o Van Nuys o a Union Station deben completar un formulario en línea, reconociendo la ley estatal que recomienda la cuarentena. Se encuentra en la página travel.lacity.org. Además, los negocios que operan al interior están limitados a un 25% de capacidad. En los negocios de cuidado personal, como salones de belleza y de tatuajes, todos deben usar una mascarilla y no se pueden servir comida ni bebida a los clientes. El estado de California tiene un toque de queda en efecto para todos los condados que están en nivel más restrictivo de COVID-19, incluyendo Los Ángeles. Estará en vigor al menos hasta el 21 de diciembre. Todos debemos permanecer dentro de nuestras casas entre las 10 de la noche y las 5 de la mañana, con la excepción de las actividades esenciales. Ahora los números nos dicen lo siguiente. Si nos mantenemos en esta trayectoria, el condado de Los Ángeles alcanzará un total de 500,520 casos de COVID-19 a finales de año y un total de 11,511 personas en el condado de Los Ángeles pueden morir. 11,511 de nuestros vecinos, miembros de nuestras familias, nuestros colegas. Y si vemos un promedio de más de 4,500 casos al día sobre 5 días, o si las hospitalizaciones superan más de 2,000 pacientes al día, tendremos que empezar a implementar soluciones más extremas. Aún no estamos allí, pero podemos llegar allí muy pronto. Hoy en nuestro condado tuvimos 6,124 nuevas infecciones, un nuevo récord. Entre ellos, 2,694 están aquí en la ciudad de Los Ángeles. Y nuestra tasa de transmisión ha subido. Era 1.18 la semana pasada. Necesitamos bajar ese número por debajo de 1. Las hospitalizaciones han subido. En nuestros hospitales de emergencia general, 1,575 personas están hospitalizadas por COVID-19, doble el número de la limpieza de noviembre, doble. En el condado hay 821 camas disponibles y hubieron 8 fallecidos hoy. Y con las hospitalizaciones subiendo, esperamos que las muertes también van a subir en las próximas semanas. En los sitios de prueba de la ciudad esta semana tenemos la capacidad de hacerle la prueba a más de 38,000 personas cada día. Mañana abrimos el nuevo sitio en el Parque de San Fernando y tendremos equipos móviles adicionales. Nuestros sitios de prueba estarán cerrados este jueves para el Día de Acción de Gracias y el viernes, pero abrirán de nuevo el sábado. Estos sitios necesitan más voluntarios para ayudar en nuestros sitios de prueba. Si puede dar su tiempo, por favor, visite response.org. Y como siempre, las citas de pruebas están disponibles para cualquiera, con o sin síntomas. Para hacer una cita, visite coronavirus.lacity.org/testing o llama 311. Y si cree que ha sido expuesto al coronavirus, hágase la prueba y póngase en cuarentena hasta que reciba un resultado negativo. Si recibe un resultado positivo, aíslese durante al menos 10 días desde que empezaron sus síntomas y permanezca aislado durante al menos 24 horas después de la última fiebre. Los protocolos de aislamiento y cuarentena se encuentran en la página publichealth.lacity.gov. Los Ángeles. Estamos pasando por los momentos más peligrosos de esta pandemia ahora. Todavía podemos evitar lo peor, pero nos falta poco tiempo. Por favor, hagan el sacrificio para frenar la propagación de este virus. Hagamos nuestra parte para mantenernos sanos y protegidos, y cuando es posible, quédense en casa. Fuerza y amor, Los Ángeles. Thank you. We'll see you soon.